welcome back. My name is Jack B., and as always, thank you for viewing my video. We're watching the spread of viruses in the U.S. now. First it was bird flu, and now it's the measles. Actually, first it was COVID, then bird flu, and now the measles. Generally, all viruses are nebulous, but vaccines have reduced the number of infected. At this time, bird flu is different because it's not supposed to be transmitted to humans directly from animal contact. Currently, it is ravishing our beef and poultry sources, and the numbers have been increasing over the last few months. The significant reduction in the availability of all these food sources could adversely affect our costs. In the last couple of weeks, the concern has turned to dread with respects to bird flu infecting humans. Initial cases of human infection appear to be from animal to human through consumption of raw milk. As more people were diagnosed with bird flu, their infection appears to be through contact with the animal, such as working on farms and ranches. It's hard to get accurate numbers of infections because of the filtering of information by the CDC at the direction of the current administration to downplay issues. The last information was that it had spread to 13 states across the U.S. The CDC under JFK Jr. reports that 41 cases came from exposure from cows, 26 cases exposure to chickens, and 3 exposures are undetermined. But the medical community believes it was human-to-human exposure for these last 3 cases. Of course, the government won't admit this and is covering things up with propaganda. As a comparison, over a 21-year period from January 2003 to December 2024, there were 954 human infections worldwide from 24 countries. Of the 954 cases, 464 people die. That's a high rate of death. Today, because they are testing each patient who is infected, they can see the virus is definitely mutating. The concern now is human-to-human transmission. As the virus mutates in humans, especially during the regular flu season, with people coming down with seasonal flu, the possibility of the two viruses exchanging their genomes and mutating further is increasingly possible, resulting in easier transmission among humans. The question now is whether we are watching the making of another pandemic, and if so, are we ready? Have we instituted plans based on what we learned during the COVID pandemic? The CDC is watching the issue, but many feel they're not being proactive. Are we just prepared to contain and treat the deadly virus as the cases increase? Or can we be prepared to prevent the virus from spreading? And whether it's for this or measles, it's the same. The medical and health experts are fearful of another pandemic. People should be given clear daily information and status about the virus. If we understand what we would be up against, then we'd be able to make better decisions. I understand we have learned a lot because of the COVID pandemic. Basically, most viruses vary in size from 20 to 400 nanometers, although some can be as big as 500 nanometers in diameter and up to 1,000 nanometers long. The avian flu virus is a type A influenza and is adapted to an avian host. Type A influenza belongs to a virus family whose size ranges from 80 to 120 nanometers. Needless to say, they are definitely in the nanoparticle range. This means they can stay airborne for a long time. Rain doesn't wash them out of the air. The topic of face masks always comes up. N95 masks, properly fitted, can protect one from particles as small as 300 nanometers. Obviously, they won't block a virus lurking about in the air looking to infect somebody. But they may block other particles, such as from a sneeze, that could be carrying viruses. It appears to me the use of face masks may or may not work all the time, but should be a personal decision, probably based upon whether their use would provide some level of mental security for the user. I understand we've learned from COVID that waiting for symptoms to appear is not the best way to identify or track the virus. It is certainly not the best way to reduce the effects of the virus. By the time the symptoms appear themselves, it's too late. Treatment should occur ASAP after exposure and infection. I also understand the medical profession believes the best way to track and identify infection is by proactively testing rather than waiting for symptoms to appear. I believe there was success in some college campuses with weekly testing and documentation. The sooner the virus is detected, the sooner treatment can occur and the healing process can begin. Transmission will occur, but herd immunity can be attained without the most severe effects of the illness if the treatment is administered properly and promptly. Common sense, which by the way is not so common, would suggest the key to addressing the potential pandemic is to have a sufficient number of test kits available and distributed to perform adequate testing, and a sufficient number of treatments available and distributed ready for use. The federal government should lead the effort to have a sensible plan in place and ensure that the plan is understood, and adequately distributed throughout the country. Many believe the CDC is not taking this situation seriously and are definitely not prepared for an outbreak. What does it take for our federal elected officials and the departments responsible for our health to take common sense precautionary action? At the very least, I would suggest the government should sponsor and provide the following immediately. And by the way, this is just not for bird flu, it's for all the viruses, particularly measles, which is hot now. Authorize the manufacture of a significant number of treatment kits, identify an adequate number of distribution locations throughout the U.S. to address treatment and testing, develop plans and schedules to get the test and treatment kits from the manufacturer to the people. I would hope that the efforts during the COVID pandemic were documented and are readily available for review and use as a basis to start the planning for the future. Our elected officials need to stop being petty and self-centered and start to think about the needs of the American public. Their actions need to be timely and address the issues that we not only see today, but what might occur in the future. They need to look ahead. They need to have long-term vision and diligently look at the cause and effect of their actions, not be short-sighted. Unfortunately, the news is filled with nothing but the Trump reality show. The measles outbreak is spreading, and the CDC is doing nothing, and JFK Jr. is selling snake oil. Next, he'll tell us to hand out garlic to put in our windows. I'm not sure how all this will turn out, but we'll see. Well, these are my thoughts for today. And again, whether you agree or not, please verify the information presented. Thank you, and until next time, take care and be safe. Bye.
Ooh.